Last week, the Health Secretary said that every care worker who needed a test would get one. But the reality on the ground is very different. And there are very few tests indeed. And the position is this. If a care worker has symptoms of coronavirus, or a family member has symptoms, he or she has to self-isolate, quite rightly. To get a necessary test, they're then instructed to travel to a testing centre, which is often very many miles away. So an example is social care workers in Leicester are being told to go to the outskirts of Nottingham, a 45-minute drive, in order to get tested. There are lots of examples across the country of this. Now, there's an obvious problem with that system. Not all care workers will have access to a car. Because they've got symptoms or family members have got symptoms, they obviously can't use public transport, so it's little wonder we're seeing these pictures of half-empty testing centres. Yep. So it doesn't look like that's a good plan. And it's not about driving up demand, it's about tests where they're needed. So what reassurance can the First Secretary give to care workers on the front line that things will improve for them and fast?
Secretary.
Honourable gentleman, it is certainly about capacity. I've addressed that in my earlier answers and also explained how we'll bridge the 100,000. It is about demand. We need to encourage those who are able to take the test to come forward. But he is right. He is right to say it's also about distribution and some of the logistical and, frankly, transport challenges that people, particularly some of those that he described, will have in terms of getting to the tests. So we're working with the local resilience forums to make sure that we can distribute the tests as effectively as possible. We've got mobile labs to go to some of those areas for the hard to reach. We'll be using the Army, who have made, along with the other key workers, an incredible contribution to support that effort. But I just come back to the key point. I do think it's important to have a target and to drive towards a target. We are making good progress. We're confident we'll meet it. And I think that he should join with me as we engage in this national effort of saying to Labour's Welsh Health Minister, Vaughan Gethin, who has abandoned the Welsh target in Labour-run Wales of 5,000, that actually we need to work together in all four corners of the United Kingdom to make sure that we reach that national effort. It is about capacity, it is about distribution. We'll only be able to manage to hit that target if all of us come together to deliver on it.
Keir Starmer.
Mr. Speaker, I do recognise how hard people are working to try to drive the number of tests up, but there is a significant gap and there's only 8 days left.